I get asked all the time, how does desensitization work when you're on medication, tapering off medication, or in active withdrawal from medications like SSRIs or benzos? So in this video, I'm going to cover what to do if you're sensitized and taking medication, how to desensitize your nervous system while tapering off of medication, and what to do if you're experiencing withdrawal symptoms while you're sensitized. I am not going to talk about specific medications in this video, although I will tell you all of the medications I've taken over the years, but that's just because specific drugs don't really matter to this process. What matters is the state of your nervous system. And sensitization is a big part of why we get put on these medications and what happens when we come off of them. So I'm not going to advise you what to do with your medication. I'm not going to reply to comments asking, should I start medication? Should I stop medication? How should I taper my medication? I am not a doctor, and nothing in this video is medical advice. The first thing that I feel is most important to address is that there is another way outside of using medications. And what I have seen and heard in, yes, watching 200 recovery stories is that it is genuinely rare for someone to be going through nervous system sensitization. And I mean all of the symptoms, because we could talk about anxiety and depression. Of course, that's most of the reason why people get put on those types of meds, but not when you're in the chronic pain or illness community, because they use these meds to treat pain, to treat nerve pain, to treat chronic pain, and they use it when you have a condition that you're dealing with. And because of that condition, you are now also dealing with mental symptoms. So now, whether you just have mental symptoms or you have pain or physical symptoms or all three, very rare to never have been prescribed these meds or to have taken them for at least a little bit of time or a long period of time. When your anxiety is unmanageable, when you can't sleep, when you're in chronic pain, when you're depressed, medication is the only real tool the medical system has to offer you. It is just a depressing reality. And that's not as a criticism. It is what it is. If you've been on these medications, it's not unusual. It's more common than I think people think. It doesn't mean that your case is too complicated, but it means that there is some nuance to recovering and being aware of what we're looking at when the symptoms are caused by one thing or caused by medication. Medication, managing symptoms, and then desensitizing your nervous system are not the same thing. Some of these medications are going to numb anxiety or make depression not feel as hard, or even have an effect on pain symptoms. I was offered many different medications for my nerve pain. Medications like gabapentin, amitriptyline, I knew all of my options, that's for sure. And I was prescribed all of it. Some of it I took, some of it I didn't take. That is what this video is about, okay? It's knowing that there is another way, but there are people that are at different stages here. There are people that are like, should I take a medication or should I not? Will this work? If I'm on a medication, I'm tapering a medication and I'm experiencing withdrawal symptoms. Should I wait? I already got off of my medication. I did a little bit too fast, and now I'm in full-blown post-acute withdrawal. I'm familiar with all of this, and I have a lot of personal experience going on and off meds throughout my life. I want to say that it probably started around when I was 18. There was a time when I was on, an antidepressant, an anti-anxiety, an insomnia med, and an ADHD med. I mean, probably 4 that I could think of. But at some point in time, I have been on Zoloft, Prozac, Zyprexa, Celexa, Xanax, Klonopin, gabapentin, Trazodone, Seroquel, Ambien, and Adderall. Those are only the ones I can think of, probably more than that. I went on and off these meds all throughout my life without much of a problem. But if you know anything about meds, they are one of the things that contributes to sensitization over time. If you're in this community, you're familiar with concepts like kindling, bind, and pause, and all those things. And I never really had any issues. But then when you combine the ongoing CPTSD, the trauma, the meds, the sicknesses, the medications, all of the things that contribute to a sensitized nervous system, I group all of that stuff together. My most recent stint, like I talked about on the last video, was when I was hospitalized. And when I was hospitalized, I walked out of that hospital with the medications were Prozac, Seroquel, Trazodone, and gabapentin. 4 medications at once because of how bad my anxiety and my insomnia and my pain were. It was on and off throughout the years. And some of them I was on for extended periods of times. Some of them I was not. And I did experience withdrawal symptoms when I came off of my SSRI. I came off it way too quick, which I'll talk about a little bit in this video. And I did experience really bad symptoms, mainly emotional symptoms. Lots of crying, despair, hopelessness, depression every 2 weeks after I dropped. So here's what I want to say. There are a lot of symptoms that you're experiencing right now that you do not have control over if you are dealing with sensitization that is in any way related to tapering off meds or coming off of meds. Your body at this point is going to do whatever it's going to do. And I know that it sucks. It's just something that you have to hang on and get through. And it does get better with time if we stop fueling the symptoms, which is what I talk about constantly on this channel. Your response is really the only thing you have control over. I want you to know that. That is exactly what my Desensitized course talks about, because right now you need to know that there is nothing more than your response to the symptoms you're experiencing from coming off the medications. So whether you're dealing with medication symptoms, taper symptoms, or withdrawal symptoms. Okay. So I just want to remind you of that. That is the main focus. Your main focus should be on desensitization, because your issue right now is a severely sensitized system. That's what I tell anybody, anytime I've ever answered this question. That is the most important thing to focus on. So all three questions, whether it's medication, tapering, or withdrawing, are really all asking the same thing, which is not unique to people dealing with or without medications. It is really common with sensitization in general, which is, am I the exception? What about tinnitus caused by benzo withdrawal? What about POTS caused by SSRI withdrawal? What about X symptom? What about this physical symptom or mental symptom caused by meds? And my answer is always going to be the same. If you are living inside of a fearful response, you are chronically living in a fearful response, which you are when you're sensitized, and you are when you are dealing with withdrawal symptoms. If your threat system is constantly firing and you're responding to that with more fear, so reinforcing that loop again and again and again, especially as symptoms spread and change and intensify, this applies to you. So if you're watching this video and you're like, oh, I was thinking of doing a medication, or I'm thinking of tapering, or whatever, if you're watching this and you are living in a chronically fearful state about your thoughts, about your emotions, about your symptoms, and about your sensations, this work applies to you. I'm always very specific that my program and my teachings are not symptom specific. So like when someone says, will it work for CFS? Is your CFS caused by a sensitized nervous system? Will it work for facial pain? Is your facial pain caused by a sensitized nervous system? And I know even asking that question can be complicated for people because they want 100% confirmation that their symptoms are due to nervous system sensitization. What made it really clear for me, which might clarify it for you, is symptoms aside. Stay with me here. Symptoms aside, are you chronically afraid of what's going on in your body and your mind? If so, symptoms aside, you are dealing with sensitization. Are you chronically anxious? Are you chronically shut down? Then it doesn't matter what the symptoms are. Symptoms are just icing on the cake. The issue is a sensitized nervous system. That was something that made it really simple for me to dive into the work, because I thought, okay, listen, my history, my trauma, all of my diagnoses, everything I've been through, all of it makes complete sense that this is a nervous system issue. Taking every diagnosis I had ever had for physical symptoms out of the picture, my facial pain, my nerve pain, all of that, I took it out of the picture. So that may help bring some clarity to you so that you can stop obsessing about individual diagnoses and symptoms and saying, am I freaking the hell out all the time? Am I panicking and trying to fix? And am I monitoring what's happening in my body like it's a full-time job? That is sensitization. So it doesn't matter. Let the symptoms work themselves out. You dig into the desensitizing work, okay? The cause of sensitization doesn't change what your nervous system needs. And that's why I talk about not digging up trauma and not doing those things. We are working with your nervous system from the state that it is currently in. So it doesn't matter if it was a medication, a surgery, a divorce, a vaccine, the nervous system doesn't categorize what the cause of this was. And it says, oh, well, if yours happened because of a surgery, you need this. Oh, if yours happened from a medication, you need this. It doesn't discriminate. Certain types of things sensitize or further sensitize the nervous system. That's why it can seem like there's one event or one medication or one surgery or one thing that causes everything, but it's not. That's just the thing that pushes it into chronic dysfunction, which is what nervous system sensitization is. It's just things are misfiring and miswiring. That's it. Let's talk about the first case, which is if I'm on medication, or the question of, can I do the work while I'm on medication? Can I do it in tandem? Many people have. Lots of people use medication as a support. They get off of it when they need it. The important thing with medication, in my opinion, is informed consent, which can be hard for us if we're anxious, because if you're like me, you spent hours on Reddit researching meds and what can go wrong. And that's why you have such an extensive knowledge, because you spent so much time learning about it. It's important to know that there are risks. And that's what needs to be weighed out. Risks versus the benefits, which you can go over with your medical professional, of course. And it can be challenging to find a medical professional that is very educated on withdrawal symptoms, and just so that you're not getting gaslit when you're like, oh, I did what you told me to do. I cut it in half and I had all these symptoms. And they're like, oh, that's your stuff coming back. You need to be medicated. It's evidence you need this medication. It can get messy out there, which if you've dealt with chronic symptoms, you're aware of that. It can be messy, and you can be told that this is just your anxiety returning or your pain is going up because you need the medication. So medication can dull the fear response, which means there may be less available fear or reaction or emotion to work with and rewire. That can possibly be an issue, but you can work with what's accessible for you right now. If your medication is giving you some floor of stability to stand on, use that stability to start rebuilding your relationship to your response. The trap here, though, is waiting. And so I get questions like, should I wait till I'm off the meds? Should I wait to taper the meds? Should I wait till I'm not withdrawing so much? Waiting is the issue. There is no downside to doing the work of desensitization, because the work of desensitization is the work of recovering from chronic fear. No downside to that. There is, however, a downside to not working on the fear, because it can cause these things to get chronically locked on for a much longer period of time than I think it takes for the system to kind of work this out, in my opinion. If you're on medication and you're reading comments at midnight and trying to figure out if what you're doing is right, I don't blame you. That's another thing that comes along with sensitization, but it's also a sign that you're sensitized, and that's what sensitized systems do. There's no real right way to do this, but I will give, my advice as far as looking into a hyperbolic taper, etc., if you're not familiar with that. So the second category of people is people who are actively tapering. And those are people who, for the most part, they're tapering, and it means that they're still on part of the medication, but they're actively working to come off of it, and they're experiencing symptoms. Again, symptoms of sensitization. I think that the decrease in these chemicals being provided to the brain and the way that it adjusted, not making as many chemicals, and then we're ripping the exogenous chemicals away. And it's like, whoa, it's trying to restabilize. It's actively trying to restabilize. But normally people are asking questions like this because they're experiencing symptoms as they taper and they're not quite off of it. Symptoms during a taper and after you have completed medication are as real as they get. They are not in your head. They are not fake symptoms, but that's the case for all of us. Any symptoms created by the nervous system, created by sensitization, created by chronic stress are very, very horrifyingly real, for sure. But they're still just the nervous system doing what a sensitized nervous system does, which is scanning constantly, firing these responses, and then waiting for how you respond. And when these things happen during a taper, it's terrifying. I really want to validate you in that, whether it's during a taper or whether you are doing nothing with medication right now. It is very scary when symptoms show up, move, get stronger, disappear, come back, all of that. But no matter where you are on the scale, response matters most. And you have to kind of override what the natural reaction is to do, which the natural reaction is to freak the hell out because what is my body doing? But I think understanding this during a taper or after you've tapered is paramount. It's important for you to understand in what ways am I reinforcing this? Innocently always, but not innocently once you have the information and you can choose to do something different. Your response to those symptoms is quite honestly the only lever that you have available to you. And that's great news because it's a big lever to pull. It's a lot of power and control over this. The trap, though, is treating every new symptom that shows up as a problem. I see this all the time. People go off of their meds or they begin a taper and suddenly they have a POTS diagnosis, they have a chronic fatigue diagnosis, they have a long COVID diagnosis, they have an MCAS diagnosis. And I'm not saying all those symptoms aren't real. I would almost guarantee that you meet the criteria of a symptom cluster for that diagnosis, but it's not a bunch of different diagnoses. These are symptoms. All of those are symptoms of a sensitized nervous system, especially if you know that they all started as you began to taper. You didn't magically just create all of these new diagnoses. Your system started firing off an alarm in this system of the body and an alarm in this system of the body until most of the systems feel like they are affected. And now you have 7 new diagnoses. That is, I believe, in my opinion, again, how people stay stuck in this loop for 5 years, 7 years, a really long period of time, because it seems like your health is rapidly declining and you now have 100 symptoms. I've heard of people having 50, 75, 100 plus symptoms that appear over a matter of a couple months, right as they start tapering or get far into a taper or taper too fast. Every time you try to go and solve that symptom or that diagnosis, again, we are telling our nervous systems that we are in danger and that this is dangerous and it's a problem to be solved, which I talk about constantly on this channel and in my course. If and when you decide to taper, whether you're actively involved in one right now or you're considering doing one in the future, it's worth your time to research a hyperbolic taper. There are way more doctors talking about this now. Please, as your friend, do not cut it in half, and then be done. Does it work for some people? Sure. Is it a really bad idea if you already deal with nervous system sensitization? Yes, it is. Most doctors are going to tell you cut the dose in half for a week, cut the dose in half for another week, and then you're good to hop off. I would not. I had not a good experience with that. Let's talk about the third category of people that I hear from a lot, and those are people that are in withdrawal. They aren't on meds anymore. They stopped the meds, and maybe immediately or maybe a month, 3 months, 6 months later, they get this onslaught of symptoms. This is, again, my opinion. I think that withdrawal from medications is one of the most severe forms of nervous system sensitization out there. And I don't say that to scare you. I say it to validate you because you are stuck in such a hyper vigilant alarm state. It's just the most extreme that I've seen and the most extreme I experienced for the short stints that I experienced at each time I dropped my dose. And people do get stuck in the state that I experienced every 2 weeks chronically for months and longer. I never experienced withdrawal symptoms any of the other times I came off of my meds. The time that I did experience them was when I was already freaking the hell out about my chronic pain. I was in a very sensitized state. And so I experienced those withdrawals at that point. And I didn't think I would because I had come on and off it so many times in the past without any issues. But you have to understand that withdrawal isn't a separate category. It's just sensitization with a very clear identifiable trigger. And I think that should bring us some comfort because it is very obvious, although it is as extreme as it can get and as extreme as it can feel. But in some ways, it is actually a bit more simpler for our brain to kind of latch onto because you know that this thing specifically is the thing that pushed my system over the edge. It's that like triggering event that comes to our mind. But the path back is the same regardless of what caused it. I have talked to many people who, just like me and the issues that I've faced, have done everything they can possibly do to heal the symptoms of post-acute withdrawal. I spoke to someone who has spent $90,000. I know of other people who spent, upwards of of multiple six figures, doing everything they could with no help at all, no improvement at all. And so, yeah, there may be things online that tell you like this could help, that could help. That's the same thing in the chronic pain world and in the anxiety world as it is in the med world. But I kind of feel like, unsurprisingly, all of these roads lead back to the same place. And that place that they lead back to is your nervous system is very, very sensitized. You have become locked, again, so innocently into this loop of chronic panic and fear and monitoring of what you're experiencing, watching our body like it is a full-time job. Then again, we fall into this path of treating each symptom as an individual problem. And every doctor we see, every specialist we see says something different and adds a new diagnosis. And every time a new diagnosis is added, a new level of fear is unlocked. And that hypervigilance about these diagnoses and these appointments and these symptoms, it's what keeps the system locked on. I believe there is a time frame here, and I believe that desensitization takes time, kind of depending on how much your body has adapted. So like how much physical symptoms you're experiencing chronically. But if you've been in withdrawal for a year, 2 years, or more than that, it's not because this is a very unique case. I think it's just because what's so common is fear is an incredibly powerful signal to a nervous system that's already on high alert. And we are so chronically living in terror and not sleeping and feeling anxiety and having new symptoms and watching our body do the most outrageous things that it wires the brain faster, is the way that I see it. Because what fires together wires together. And when we're firing this fear and these symptoms and this attention, the brain just links it up. And it just gets linked in the brain over and over again. And that's okay. Our brains are neuroplastic, which means they can change. There is hope for you. You can recover. And the main thing you have control over is that response. And remember that when the fear comes down, you're able to have a better response to your symptoms. So we don't really worry about the symptoms. We focus on the response. The only thing that I had control over was my response to what was happening. Didn't matter if it was the withdrawal symptoms, the pain, the anxiety, the insomnia, whatever I was dealing with. Again, please put all of these things under the same umbrella, because at this point, what other option is there? This is what we have to work with right now. I can't guarantee for anyone that all of your symptoms are going to disappear or that all of them are going to disappear in this time frame. But what I know for certain is if you're living in a state of chronic fear around what is going on in your body and your mind, sensitization work is the best focus of your very limited capacity, resources, focus, and attention right now. And the response is what will change the trajectory. If you cannot override your fear, because I want to say this explicitly because it's so challenging, but I need you to hear it, not to scare you, but to get real with you for a second. If you cannot interrupt this pattern that I know is so automatic, like I said, it ended me up in the hospital because it was so automatic and I could not break out of what my brain was doing, which was like, I can't freaking do this forever. When my symptoms started, this is aside from withdrawal, but I know that loop. If you can't override that, if you can't break through it, you continue to walk down the path that reinforces the symptoms, the anxiety, the fear, and the withdrawal experience that you're having. So it's very important to understand, although I know your fear and survival brain is just on fire right now, and it's just like constant panic, constant hyperarousal and hypervigilance, the more you start interrupting that, the more you start redirecting where you're headed. And you have to redirect where you're headed if you want the opportunity for these symptoms to realize they're not needed anymore. I know how hard this can be. I've been locked in that same loop. If you're watching this, you have probably been locked in that same loop. No one can help you cross this bridge. I can say it again and again on this channel, and I can say it over and over a million times in my course, which I do, but it is on you to be like, what I'm doing right now, as important as it feels, as urgent as it feels to find the next specialist, even though I've gone to 47 of them so far, as important as that feels, if I keep doing this, I'm reaffirming and reinforcing my symptoms and my experience and the experience of withdrawal. If I want relief from this, I must break away from that pattern more and more and more until the new pattern becomes forged in your brain. It is not your fault that you're dealing with this. And I'm sorry that you are, because it's such a feeling of being kicked while you're down to be like, I got on these meds to help with this issue. And now I have this issue and I'm getting off these meds. And now these meds have caused a bigger problem. I get it. I agree that it's very unfair, but that's where the acceptance comes in. This is where you are right now. This is what we're working with. And we can berate it all day and we can just like be like, this shouldn't have happened. We can resist it and we can fight it, or we can say, hey, it's wake up time. This is where I'm at right now. It fucking sucks. And I have an option here to be brave and redirect as often as I can. In the beginning, it's going to be challenging, but it gets easier and easier when you interrupt it and you see like, I'm still okay. I hate this experience, but I'm still okay. So these are times where symptoms are screaming so loud that they really, really are trying to give a signal to you that like you are in danger. And we have to remember that loud doesn't mean dangerous. So take care of yourself, do what is helpful for you, and know that whether it's being on medication, tapering from medication, or withdrawing from medication, all three of those things are asking the same thing, which is, does the work of desensitization apply to me now with how bad things are, with how bad things have been, even with me feeling like these meds are actively helping right now? Does this apply to me? And again, the answer to that question is, if you're living in a chronic state of fear, sensitization work can only be helpful, because there's no downside to reducing the fearful approach that you're taking to your life. That is the work. That is what changes everything. So today, not when you're off the meds, not when withdrawal is over, not when you get to some like shiny place in the future. Today, experiment. When a symptom shows up for you, when a sensation, when a scary thought shows up for you, just notice what your response is to it. That's going to give you the answer of whether or not this work is helpful for you. Because if you tend to freak out, pull out Google, pull out Reddit, go into a Facebook group, try to find some type of solution, then you're still in that fixing and monitoring mode, hoping that there is some like golden ticket out of this. And the golden ticket out of this is a retrained response behaviorally to what it is you're experiencing. I'll see you guys on the next video. Bye, everybody.